Hello, everyone. My name is John, and today I'm sharing a project that is very close to my heart. It's called HopeCast. So it's an AI-powered tool that not only predicts breast cancer survival, but also explains in plain language what treatment paths make sense and why. And it also gives advice of what steps to be taken. So HopeCast combines deep learning, real patient data, and medical literature to offer both prediction and hope. Let's start with the problem. Breast cancer is the most common cancer in women. For many patients, especially after diagnosis, there's so much fear and unfortunately so little clarity. They often ask, how long do I have? What can I expect? Is this treatment the right one for me? And more often than not, those questions go unanswered or stay vague. So I asked, what if we could give those answers in a way that's accurate but also understandable? That's what HopeCast aims to do. So to build this, I used a powerful data set called MetaBrick. It is data from around 2,000 real breast care patients. It includes clinical features like age, tumor size, surgery type, genetic data, how genes are expressed, mutation data, that is, whether certain cancer related genes are mutated. Each row in the data set represents a person, and that makes every prediction. I think the rules in the data set, it would correspond to a mother or a sister or a friend, and that makes every prediction we build feel personal. So there has been amazing work on this data set. For example, Pereira in 2016 used it to define breast cancer subtypes. DeepServe introduced a deep learning version of a survival model, but there's always something missing. Most models just predict numbers. They don't explain them. They don't speak in human terms. So with HopeCast, I wanted to combine state-of-the-art modeling with real-time explanations and make it accessible as a simple web application. And not only that, we also use PubMed plus Grok API to explain the treatment parts. To evaluate a HopeCast, I use something called the concordance index or the C index. This tells us how a model ranks patients in terms of risk, which matters deeply in cancer care. If your model can't tell who is more at risk, it's no better than flipping a coin. A score of zero point 0.5 means, so if we see over here, when we talk about the metric selection, a score of zero point 0.5, it means random guessing. About zero point 0.7 is considered very strong, and zero point 0.6 to zero point 0.7 is acceptable in survival models. But HopeCast aims a target above zero point 0.7. It's not to choose a number, but to make every prediction as meaningful as possible. So when I talk about my modeling approach, how did I build this? By step from scratch, if I want to talk about, I first downloaded and organized the data set. I used Kaggle app to extract it, and then I cleaned and split the data set into three parts: clinical data, like age and tumor, stage, genetic data, and mutation data, as I explained earlier. And then I used all the cleaning methods as mentioned here. And then, as I mentioned over here, I did all the feature separation, splitting into three data sets, and I trained three models, one on each type. I used a naive model that just predicts the average, an XGBoost model for structured learning, and a DeepServe, a deep learning model that is specifically built specifically for survival analysis. So the best results came from uh, the best results came, as I talked over here, you can see the models that I built, and I selected DeepServe on clinical data because the best result came from DeepServe on clinical data, which makes sense. So doctors look at clinical info to make decisions too. So over here, if I do a model comparison, you can see that the naive model scored zero point 0.5 in all the three data sets: clinical, mutation, and genetic. XGBoost gave an improved accuracy, gave an improved C-index score in clinical, mutation, and genetic. But our deep sub, that is our deep learning approach, it gave a awesome C-index score. And in clinical, we got a C-index score of 0.7135, which is strong and reliable. And we could say it is a 21% improvement. In naive, we got zero point 0.5. In deep, so we are getting 0.71. So it's a 21% improvement over the naive baseline. So it tells us when we feed the right data into the right model, we get real and reliable insight. And when I talk about my RAG explanation, it's not just about prediction. I added a RAG, as I said earlier. This pulls real treatment insights from PubMed, which is a prominent database, medical database, and sends them through a language model. So the explanation is clear and personalized. And we use the Grok API to tailor the treatment suggestions. So, for example, if a patient has HER2 plus cancer and stage 3, the app might say stage 1, the app might say patients with similar profiles benefit from prostamab therapy with regular follow-up. It gives patients something to understand, something they can talk about with their doctor, something to hold on to. So now I will run through a basic demo of my application. So I'll go over here, and then if you see over here, this is a web application. This is deployed in GCP. And then I have already given the input details, the age, what kind of cancer, whether the patient is taking chemotherapy, and cancer type detailed, and all such inputs I have given. Uh, and then I'm just clicking predict and explain. So over here, you can see the survival probability over time. It says at 20 months, there's a 99% chance of survival. At 160 months, there's a 93.5% survival chance. At 318 months, there's 11% chance of survival. The median survival time, you have a 50% chance of living beyond 21 years and 7 months. So 50%, we call it as the median survival time. And this means that half of the patients with similar characteristics are expected to survive at least this long. So here we are using the same text score and we are ranking, and it is using the concept in such a way as it ranks all the patients. For example, the patients who are riskier will be given a higher say index score. As such, the thing carries out. And then we give a treatment advice based on the inputs given by the user. You can see, based given the patients here positive, hormone therapy is a cornerstone, and then it says that person has already undergone chemotherapy and consideration for additional chemotherapy, and it also gives advice on targeted therapy. And then it says it gives all the treatment options, and over here it gives some personal advice as well: personalized medicine, quality of life discussed with an oncologist, future consideration, how do you have to manage your lifestyle. We see all such things in our application. And over here you can see I use clinical. You can also use genetic or mutation. You can input all the details, and as you take a test from a oncologist, you'll get all the details about the genes, about the mutation stuff and all. You can input all the details and you'll get a personalized advice, personalized treatment options. How long can you survive, and what is the chance of survival after a particular period of time? So we could do all such things. So when I come back to my presentation, when I talk about my results and conclusions, so what did I learn? The clinical data is most predictive. Deep Surf give the best results. But the biggest impact came when I combined predictions with explanations. That's when the app stopped being just technical and started becoming useful. There's a long way to go. I want to expand this to other things as well, as recurrence prediction, supporting mobile platforms, and improving the explanation system. But I believe HopeCast is a start, and it's a step forward it's a step toward making AI in medicine not just powerful but personal. So when I talk about my ethics statement, of course, ethics matter. Upcast does not replace doctors; it supports them. It does not give medical advice; it gives a context, and there are some limitations as well. It's built on real anonymized data. It's transparent, open access, and there would be some bias and historical treatment records, and no user data is collected because in health, trust is everything, right? And it's very important that I have built this with that in mind. And as I have taken XAI class under Dr. Ben, it's very essential to consider, to give much importance to ethics. So closing, I want to say, to everyone fighting cancer, supporting a loved one, or building better tools, Opcast is better for you. Let's keep building AI that heals, not just predicts. And I'm very thankful to Dr. Ben for the amazing class and for the amazing opportunities that she gave to showcase our projects, to showcase our technical skills. Thank you.